Good morning. I'm interested in finding out if you know anything about a new treatment for osteoporosis called IV Reclast.
Sure.
Apparently, it's something brand new that's done with intravenous in a doctor's office.
Well, it is done with intravenous and it is done in the doctor's office, but it's not brand new. It's been around for quite a while. It's newer than the oral bisphosphonates that we've had back in the 1980s, but it has been around for a decade or so. It's usually second stage therapy. They often try the oral meds first, and if you're not getting a response, then they go to the Reclast. Reclast is effective. It does the same thing the bisphosphonates do. It just does it harder and faster. You take one IV infusion about every 6 months or so. The good news is you only need to go in and get an intravenous squirt every 6 months, and it works during that whole period. The bad news is if you have a bad reaction to it, you're stuck for 6 months. So, that's the blessing and the downside of long-acting treatments. Reclast, just like the bisphosphonates, gives you a harder outer cortex to the bone. And that means that the bone is hard, it's less likely to break, but it's not a normal bone. That inner matrix, that lattice work of bone on the inside of the bone is still shriveling up and going away. And so you get an artificial structure. And if it does break, it will often heal much slower and with more problems than a healthy bone would. So it's not my favorite way to treat osteoporosis, but it is a common way because, well, the pharmaceutical companies love it. Reclast is not cheap. And the doctors only need to give you one quick treatment in the office, and they don't have to see you for 6 months. So it's fast and convenient. I prefer to grow natural bone. I prefer to boost the osteoblasts that make new bone by using dehydroepiandrosterone and testosterone. I prefer to inhibit old bone being dissolved by raising estradiol levels. And, in our clinic, we see many people over the course of years, they start off with thin old bones, and as the years go by, their bones get thicker and thicker and harder and stronger because we're growing natural, healthy bone instead of the artificial matrix that is produced with the bisphosphonates or the Reclast. So it works. The one reported real downside is make sure you have any dental work done before you get your Reclast, because people that have dental trauma, need a root canal or dental surgery, after you've got the Reclast on board, you can end up with osteonecrosis of the jaw, where the jawbone actually dies in result of the dental trauma. So that's the one big scary side effect with Reclast.